want to look into a test that helps predict whether a woman is going to develop fibroids later in her life, or whether she's going to develop it soon or sometime in her life. This is a test that has been developed at the the Vanderbilt University. That's in Tennessee, and basically the test looks at fibroids from a genetic perspective, and I think this is a great discovery. It can help prevent, or maybe look at a way to see if you can, let a woman know early enough so she can do something about fibroids. I think there are some empowering strategies women could use to prevent developing fibroids later in life, or even at the current time. Right now, there seems to be a lot of hysterectomies occurring because of fibroids. And to me personally, I find it alarming that so many removals of uteruses occurring during surgery. Surgical solutions, basically. I know there's also some other solutions as far as removing fibroids with microscopic incisions or something like that, or even some type of medical treatment, or there's another treatment. I think it's supposed to reduce the size of the fibroids in the uterus. I would prefer that method, but again, I'm not a doctor. I just think it's kind of alarming that so many surgeries occur where the uterus are being removed, regardless of whether they're at an older age or not. Sometimes women are in the middle of their childbearing age, right? And I know they say there's 3 types of fibroids. There's fibroids that grow into the uterine cavity, and then there's fibroids that grow within the wall of the uterus, and then there's fibroids that grow outside the uterus. And they say some grow on stalks, they grow out like mushrooms. I think that's less frequent than the previous 3. I want to look at some stats. I'm going to ask my AI, hey Max, could you give me some stats and some facts on fibroids and the risk factors?
About 20% to 80% of women develop fibroids by the time they reach age 50. Fibroids are most common in women in their 40s and early 50s. Not all women with fibroids have symptoms. Fibroids become more common as women age, especially during the 30s and 40s through menopause. After menopause, fibroids usually shrink. Having a family member with fibroids increases your risk. If a woman's mother had fibroids, her risk of having them is about 3 times higher than average. Women who are overweight are at higher risk for fibroids. For very heavy women, the risk is 2 to 3 times greater than average. Eating a lot of red meat, example beef, and ham, is linked with a higher risk of fibroids. Eating plenty of green vegetables seems to protect women from developing fibroids.
Thanks, Max. I appreciate it. I want to look at this test that occurs, this test that has been developed at the Vanderbilt University. And basically what they did was they took a genetic scan of different genes. From the way this test is, from the foundation of this test, or the basis, it's based on the fact that fibroids occurs in certain women who have a variant of genes, right? Not just one gene, but a variant of genes. So the way it's set up is they took a data set of, I think, 400, a little over 400 women. I want to say they had 2,600 patients in the first test. The first database had 2,600 patients, 429 in the second set. Okay, I'm trying to make this as clear as I can. So basically, they took 2,600 patients, and these 2,600 patients were diagnosed with uterine fibroids. Okay, so they classified them according to symptoms and characteristics, menstrual cycles, pain, whether they had benign tumors in their other organs. And with this information, they compared the fibroid cases with a control group of 4,300 women. And they wanted to create a risk scores. So basically they took 2,600 patients who had fibroids, and they categorized them according to their pain, menstrual cycles, organs. and they compare that to a control group of 4,300 women. Okay, then they took a second data set of 429 fibroid patients, and they compared that with about 4,800 women without fibroids. And this is where they found that the women in the second database who had fibroids had similar gene variants as the women in the first data set with the 2,600 patients. So the 2,600 patients versus the 4,300, and then you had the 429 versus the 4,800. Now, these different sets of fibroid patients had a common gene variant, and for some reason, they don't know how, but this helps them identify whether someone is going to have fibroids or not. So let's say you don't have fibroids right now, but if they find these gene variants in your genome, then you have a high risk of developing fibroids at some point in your life. So I think this is a good way to predict and help prevent fibroids, whether it's, diet, preventing obesity, watching your stress levels, watching your hormone levels. At least this is like empowering you to resolve the issue yourself, so you may not need surgery, or may reduce your risk of having surgery. Hopefully, you don't have any pain when it comes to going to the bathroom or when it comes to a cycle. And I think, for me, I'm not a woman, but I guess I don't like the idea of so many of these surgeries occurring. I don't like the idea of just, people are always quick to cut when there are alternative solutions, especially when you can reverse the issue, right? I think this test can empower women to reverse the development of fibroids in the uterus, and I think it's a good step. It's a good step. Hopefully this will be available to anybody who's interested, and that way, again, it puts power in their hands to do something about it before it gets too bad. Because right now it just seems like it's happening in so many women, and I've even known people this happened to, and I've known some it wasn't really bad. Others, they experienced a lot of pain. They had to go to the emergency room. It was really bad, just because of the pain and them, having to use the bathroom or it affecting their cycle. And I think that this is not healthy, especially for women who want to have children and may not have had them yet. It can really affect them, and I think this would be a huge step in preventing any issues when it comes to pregnancies or delivering babies, or even just in general, just having whether it's just basically having a cycle, or just living your life without the pain and uncomfortable feelings that this brings on. So let me know what you think about this test. Those of you who experience fibroids, or those of you who are experts, can chime in. Let a layperson like myself give us more info, so we're more educated on the topic. But I appreciate you taking time to listen. Thank you very much.